teaching you that model. Okay, got it? Okay. Now if we have time, you'll be able to present it to the whole class. In other words, get up here and say, that's this part, that's this part, that's this part. Okay. Or, okay, when I turn you loose for lab, you may have somebody that comes to you and says, teach me this model so I don't flip this test. Okay? Okay. All right. All right. We're starting the cardiovascular system today, and we're starting with the heart. Now, you're probably going to get sick of hearing it, but for the whole rest of the semester, we're going to be talking about the blood one way or the other. Okay? Now that we know the parts and the components of the blood in a basic sort of way, now we're going to start talking about how the blood gets where it's supposed to go in the body. And that's the cardiovascular system. Now, the cardiovascular system is a really big, hairy deal. And sometimes the students get the impression that the cardiovascular system is hard, or the physiology is hard. If you can understand how a sprinkler system works, you can understand how the cardiovascular system works. Okay, it's not any harder than that. They just use big words. Okay? The pump for your sprinkler system is what causes the water in your sprinkler system to move around, correct? Mm-hmm. Okay. So for your cardiovascular system, the pump that you have is your heart. Now, back in the day, back in ancient times, people knew more or less what people's body parts were, but they didn't know what they did. Okay? And in ancient literature, they thought that the heart was where a person did their thinking. They didn't know what the brain did. Okay? The brain was just kind of up there, and they thought maybe it was a radiator, maybe it just cooled their head or something. They didn't know what that pile of mush up there did. Okay? But the heart was where a person was supposed to do their thinking, where their personhood resided. Okay? So all throughout history, and the poetry, and the art, and everything, okay, the heart. You see ancient Egyptian, the whole, we call them the funeral texts in ancient Egypt. They had the scales up there, and the deceased person's heart would be on one side, and there would be a feather on the other, and all that stuff. Okay, in the Bible, when it talks about a person's heart, I'm talking about where the person does their thinking. Okay? Now we know that the heart is not that. That's not what the heart does. The heart is a pump. Okay, it's actually two pumps, okay, that are side by side and work together. One half of the heart pumps blood to the whole body system, okay, everywhere from the tip of your head to the bottom of your foot. The other pumps blood to your lungs and back. Okay. Now, if you have a real good imagination, and you take the heart and turn it upside down. In fact, where's Rachel? You turn this heart upside down like this, and you look at it, or even like this and look at it, and you have a real wild imagination. It sort of looks triangular. Anybody see that? Okay. The tip of a triangle is called the apex. Correct? Mm-hmm. The flat part of a triangle is called the base of the triangle. Okay. So this part of the heart is called the apex, and this part of the heart is called base. But the heart, your triangle, is sitting in your chest like this, and that makes the apex pointed down and towards the left. The apex is pointed down and towards the left. Everybody's heart is approximately as big as their fist. Okay. Maybe a little bigger if you're an athlete. Okay. It's going to be tinier if you're a tiny person. Okay. So obviously this heart belongs to somebody who's bigger than me. Okay. It's a little big. Okay. Now, understanding that the heart is pointed down and towards the left is important because when you listen to the heart, okay, you can tell different things about how the heart is functioning by where you listen. You also can feel the heart doing its thing. Okay? And the place that you usually can feel the heart the best is called the point of maximum impact. And in women, it's on the left side here, right below the left breast. Okay, the point of maximum impact. That's where the apex of the heart comes the closest to the ribs. Okay. Now, you can listen to the heartbeat at the PMI, or the point of maximum impact. You can also stick your hand there and you can feel. Now, if you can't feel your heartbeat there, don't worry about it. Okay? It depends a lot on how thick your chest wall is. But in disease states, often they can feel what's called a thrill right there over the point of maximum impact. They can feel vibrations there. Okay? The heart is located inside its own cavities, inside its own set of membranes within the mediastinum.
Is it
Sure.
also that way with newborns?
Yes.
As far as like point of maximum
Yes.
impact is a sore spot?
Okay. The heart with its membranes is located anteriorly, just behind the sternum. Okay. You remember that when you are placing your hands for CPR, you take your ring finger and you run it up the rib margin until your finger stops, and then you put two fingers and then the heel of your hand. That gets you right over the heart, okay, instead of down over the xiphoid process. Okay. And then it points down and towards the left, and the point of maximum impact is right out here. Okay, notice that the heart is sitting on the diaphragm. Notice also that between the heart and the great vessels that are sticking up here, you have something that sort of looks like a boot. Again, if you have a real wild imagination. Okay. So when they look at x-rays, they're looking at that boot shape of the heart, and that's pretty much most of what they can tell when they're looking at an x-ray. They can tell if it's too large, they can tell if it's shifted one way or the other, but they can't tell much else with an x-ray. Way anterior in the chest. Notice also that the lungs sort of wrap around the anterior portion of the heart. So if you are needing to stick a needle into the space that surrounds the heart, you have to know exactly where you want to put that needle, because you don't want to have to try to stick a needle through the sternum. You don't want to have to try, coming in from the side, you're going to hit lungs. Okay? So when they do advanced cardiac life support, that's one thing that they teach. Okay? Where exactly you put the needles. Okay. Now, the sac that the heart is sitting in is called the pericardium, or the pericardial sac. And if you remember the whole visceral and parietal doopy-doo with membranes, okay, there's a parietal pericardium and there is a visceral pericardium. The two are separated by a potential space that has serous fluid in it. So the heart can beat within that sac. It can flop around within that sac, and it doesn't get hung up on anything. Okay? It slips and slides within its own little sac. However, if you get an infection of the pericardium, it's just like having an infection of the peritoneum. Okay? It irritates the membrane and makes it sticky. Now, if you're supposed to slide back and forth over a membrane and you make the membrane sticky, then it starts doing this, right? Okay? That's usually very painful, and also you can hear it. You put your hands up by your ears and do this. That's what a pericardial friction rub sounds like. Okay? And that is a symptom of pericarditis. Okay, pericardial friction rub. Okay, now that's simple enough, but this being anatomy and physiology and everything having to have more details to it. When you look closer at the pericardial layers, the parietal pericardium actually has 2 layers to it. The parietal pericardium, the part on the outside of the cavity, has 2 layers to it. It has a fibrous layer, and then it has the damp serous layer. Now, the fibrous pericardium is just like fibrous tissue anywhere else. We've seen fibrous tissue in the sclera. We've seen fibrous tissue in the dura mater. Fibrous tissue doesn't expand. So if you fill up the pericardial cavity here with blood or with fluid or with air or whatever, what do you do to the pressure inside the pericardium? You increase it. Can the heart empty and fill properly if you have all that other junk in the space?
Mm-mm.
No, that's called cardiac tamponade. Okay. So your fibrous pericardium, your serous pericardium, those are the 2 layers of the parietal pericardium. And then you have the visceral pericardium, which does exactly what you would think it would do. It attaches to the organ itself, in this case, the heart. Now, this is AnP, and everything has to have more than one name. So this lining on the outside of the heart itself is not only called the visceral pericardium, it's also called the epicardium. So the parietal pericardium is made up of a fibrous layer and a serous layer. The visceral pericardium is just 1 layer, but it has 2 names. The visceral pericardium and the epicardium. Epi makes sense because that means what? Above or on top of. Okay. Below that, you have your cardiac muscle, which is called the myocardium. The myocardium. So an MI is a myocardial infarction. The myocardium, as you already know, is made up of cardiac muscle tissue. Inside that, you have your heart chambers. Your heart chambers are what fill up with blood and what gets squished so that the blood will come back out. Those heart chambers also have a lining membrane called endocardium. Endocardium. All these linings here are epithelial tissue except for the fibrous portion.
Myocardium is epithelial too? No?
Excuse me. This one, endocardium,
Yeah.
epicardium, and then the serous parietal pericardium are endothelial or epithelial tissues. Right, now, it's important to understand a couple of things. Your pericardial cavity is that little space between your parietal pericardium and your visceral pericardium. There's not a lot of space in there ordinarily. Okay? It's more of a potential space. Also, your blood sloshes around here within your heart chambers, but your myocardium does not get its blood supply from the blood that's sloshing around in here. Your myocardium doesn't get its blood supply directly from the blood that's sloshing around inside. Your heart has its own little circulatory system called the coronary circulation. The coronary blood vessels run in that serous pericardium on the surface of the heart. So one of the things that the girls are going to be looking at and showing us is the names of these arteries and veins on the surface of the heart. Okay. Eventually the tiny little branches there go down into the myocardium. Okay. So a coronary is another word for a heart attack, which is another word for a myocardial infarction. In all those cases, what happens is the coronary circulation gets blocked off and the myocardium can't get any blood. And so then it starts to die. Now, sometimes people wonder, if the heart's full of blood, how could the heart not get enough blood? Well, now you know why. Because it doesn't get its circulation from the stuff that's sloshing around inside. It gets it a different way. Okay, that heart wall, that myocardium, is made up of cardiac muscle tissue. You remember that cardiac muscle tissue is striated and it's involuntary, which means that you don't have to sit there and remember to tell your heart to beat. It'll just do it. Striated means that the actin and the myosin bundles are lined up so that you can see stripes. Now, if you remember, the thing that's different with cardiac muscle is
Branches.
it branches more. It's not lined up like a bunch of soldiers on parade so much. It kind of goes this way and that way. It branches and it's a little more crooked. The nuclei that you see in cardiac muscle tissue are more fat and round. Skeletal muscle tissue, they tend to be squashed off to the side somewhere. The other thing that you see in cardiac muscle tissue is intercalated discs. Intercalated discs are these black lines that you can see, if you're lucky, between groups of adjacent cardiac muscle cells. Intercalated discs are gap junctions. They are holes through the hedge that allow the adjacent muscle cells to communicate with each other. The myocardium functions together as a community, cooperatively, how midwives are supposed to act. They don't always act that way. The $100 word for doing that is functional syncytium. a functional syncytium is a group of tissues, or a tissue that functions all together. So all of these cardiac muscle cells in here contract cooperatively. So when the heart beats, you actually have a coordinated pressure that is generated within the heart chambers. If the little cardiac muscle cells do their own thing, one of them contracts over here, and then one contracts over there, one contracts over here. Are they moving anything around?
Mm-mm.
No. That's called cardiac fibrillation. Okay? And you're dead. So it's real important that these little monkeys cooperate. Okay. Now, another thing that is important to remember about cardiac muscle tissue, cardiac muscle does not have as well developed a sarcoplasmic reticulum. You remember the sarcoplasmic reticulum is where the calcium is stored. Cardiac muscle does not have as good a calcium storage system. Remember, you need calcium for the muscle to contract. So cardiac muscle not only uses calcium from its sarcoplasmic reticulum, cardiac muscle also uses calcium from the extracellular fluid. There are calcium channels in the walls of, or in the plasma, the sarcolemma, the plasma membrane of the cardiac muscle cell. And so the cardiac muscle cell can use those calcium channels to get calcium in and make contraction more effective. That's an important detail because there's a whole category of medications called calcium channel blockers. And what do you suppose they do? They block calcium from getting in there. Okay, and one of the places where they have an action is on the heart.
So the calcium isn't coming from the sarcolemma, it's coming from these channels that are coming from
It comes from both.
both.
It comes from both.
Okay.
If you completely block all the calcium channels, can the cardiac muscle cell still contract? Yes, because it has some calcium. Okay,
Yeah,
but it can't contract as effectively or as strongly
I see.
as it should because the calcium channels are blocked. Okay, now cardiac muscle is arranged in bundles. Cardiac muscle is arranged in bundles. The bundles up here on the upper end of the heart contract to push things this way. Okay? They contract to push things this way. The cardiac muscles here contract in sort of a ringing motion to push things this way. Okay? So you've got a group of muscles pushing things this way, you've got another group of muscles pushing things this way. Now, cardiac muscles are not only arranged in sort of a circular pattern so that they can squeeze those spaces, okay, they also are attached to what's called the fibrous skeleton of the heart. And I have a picture of that down the road a little bit when we talk about the valves. The fibrous skeleton of the heart gives a place for the valves to sit. It gives a place for the muscles to be attached to. And it also separates the upper part of the heart here from the lower part of the heart. we look at the surface of the heart, let's look at the way that blood travels through the heart. Look at the way that blood travels through the heart. You need to be really, really, really familiar with how blood travels through the heart. If you understand and you can tell yourself the little story of how the blood travels through the heart, this chapter is not going to be very hard. If you don't, and you can't remember how the blood travels through the heart, this chapter is just going to be a whole bunch of disconnected stuff that you're going to be trying to remember. Okay? So let's walk through this little story here. Okay? The blood returns from the body to the heart via the big veins. There's two main big veins, the superior vena cava and the inferior vena cava. One coming from up, one coming from down. The blood from those comes into the right atrium. Now, a word here. When we have gone through the skeletal muscles and the bones and things like this, I have not made you tell me left and right. With the heart, you have to tell me left and right because it makes a difference. Okay? One side of the heart is pushing blood to the lungs. The other side of the heart is pushing blood to the systemic circulation. And they've got different stuff going on. The pressures on each side are different. The structures are thicker or not as thick, depending on where they are. It makes a difference. So in the heart, if it has a left and a right, you have to tell me left or right. Now, back 100 million years ago when Disney World was new, and you went into the Haunted Mansion, if there weren't very many people there, you could walk right on through the waiting areas into the ride. Okay? But if there were a bunch of people there, you not only had to stand in line, but then you went into this room, okay, and they tried to change the size of the room on you, okay, which was supposed to be scary. The room was supposed to be squeezing in on you. Okay? In other words, there was an antechamber before you got to the main event. Okay? Your heart sort of has that too. Your heart has an atrium, which is sort of the antechamber for the rest. Now, just as if the Haunted Mansion was empty and there wasn't anybody in there, okay, you can go right, the blood can go right through the right atrium and start to fill the right ventricle. So the blood will flow through these veins, through the right atrium, and will fill the right ventricle. Is anything pumped yet? No. Okay. Eventually here, though, your right ventricle is going to get full. When that happens, the blood is going to start stacking up back here in the right ventricle, correct?
Mm-hmm.
And then the right atrium, excuse me. The right ventricle is going to get full. Blood's going to start stacking back up in the right atrium, and then the right atrium is going to be full, correct?
Mm-hmm.
Okay. At that point, the right atrium contracts and it squishes the blood that's inside it down here into the right ventricle. Now, if the right ventricle was already full and the right atrium contracts, the right ventricle is going to have to stretch a little bit, correct?
Mm-hmm.
Okay, and it does. It stretches a little bit. When the right atrium contracts, it sort of tops off the right ventricle and causes the right ventricle to stretch a little bit. That's important because if you remember back with the whole sliding actin myosin doopy-doo,
Mhm.
we said that a little bit of stretch will make your muscle contraction more effective, more efficient, okay, as opposed to not very far to go or completely disconnected. Okay, a little bit of stretch would give you a more forceful contraction. Here is one place where you see that. Okay, the right atrium pushes that blood into the right ventricle, stretches it a little bit, which is going to make the right ventricle contraction more effective. Okay. So after the right atrium contracts and pushes blood into the right ventricle stretches a little bit, and then it begins to contract. Now, remember, we said that the upper portion of the heart up here contracts this way. The lower portion of the heart contracts up that way. Okay? So, if this blood is being squeezed on, where's it going to want to go? Back out the door here. Okay? So there needs to be something between the two chambers there so that the blood doesn't go just squirting it back out where it came from. Okay? So there is a door or a valve between the right atrium and the right ventricle. That valve has at least 4 names. 3 names. 4 names. Okay. If you look at it, it looks a little bit like parachute cloth. And it has 3 leaves to it. So it is sometimes called the tricuspid valve. It has 3 leaves to it, so it's sometimes called the tricuspid valve. However, it's also between the atria and the ventricles on the right side, so it's sometimes called the right atrioventricular valve. But nobody wants to go around saying right atrioventricular valve all day, and so it's sometimes called the right AV valve. Do you have to know all 3 names?
Yes.
Of course. Okay. On a lab exam, which name do you put? Yeah, what do you remember? Any of the 3. Okay. Any of the 3.
What was the last name that you said?
Right AV valve. Okay. All right, so any of those 3 is correct. Okay. Now, these cusps here, to me, they're sort of like a swinging saloon door. Okay, you know those old time, you ever watch a Western movie with those doors on the saloon, and you gotta wonder why they're there. Okay, you can just go busting through them this way, you can bust them through them that way. Okay. These doors are kind of like that. Okay. Do you want the doors blowing back that way?
No.
No. So to keep that from happening, they're tied down on one side. Okay. These little ties here that keep the doors from blowing back that way are called the chordae tendineae. And they are attached to little muscles here called papillary muscles. They are attached to little muscles called papillary muscles down here.
Papillary muscles. Got it.
Okay, so the right atrium squishes blood down here. The right ventricle starts squishing blood back this way, but it's going to squish back into the right atrium unless the door closes. So the door closes. And you can hear that. It's called lub, or S1, which means the first heart sound. Okay. So when the door closes, now you can squish on the blood, the ventricle can squish on the blood as much as it wants to. What's going to happen to the pressure within the ventricle? It's going to build and increase. Eventually, the pressure is going to get so much that it blows the back door open. The back door, in this case, is the semi-lunar valve. Now, what does lunar mean?
Moon.
It refers to the moon. Now, on Saturday night, I happened to be down in Tampa with my husband for a business dinner, and the moon down there was just like this.
Mhm.
Okay, it looked like a saucer. Okay. The semi-lunar valves look just like that. Okay, they look like three little saucers stuck together. Okay. Whereas these sort of look more like parachute cloth. Those look like little dishes. You have one on each side, so this would be the right semi-lunar valve or the right SL valve. But this blood is also headed for the lungs. So this is also sometimes called the pulmonary valve or the pulmonic valve. Okay, so this one has four names. Right semilunar, right SL, pulmonary valve, or pulmonic valve. All those are referring to that little piece of hardware right there. Okay. So the ventricle squishes. When the ventricle squishes, it puts pressure on the blood. When the pressure is high enough, the SL valve opens and the blood streams out here into the pulmonary artery. Now, a word here about artery versus vein. What's the difference between an artery and a vein? Very good. One goes to the heart, one goes away from the heart. Sometimes students say one has oxygenated blood, one has deoxygenated blood. Not always. Okay. Here we have deoxygenated blood coming back from the circulation. Okay. And it's going away from the heart towards the lungs. Okay. So this is the pulmonary artery or the pulmonary trunk. Blood goes out, goes to the lungs, gets oxygenated. Yes, Emily?
So the blood is coming deoxygenated from the body through the right pulmonary artery?
It's coming from the right, or it's coming from the superior vena cava, the inferior vena cava to the right side of the heart, and then it's getting pumped to the lungs through the pulmonary artery.
Okay, just because it says right pulmonary arteries over there.
That's because
Oh,
when this
that's
goes
the
up
separate
here,
thing.
it splits out to go to the lungs.
That was just the-
Yeah, it's like opposite in the heart.
Okay. All right. Okay, so when you look at this heart, okay, you can see it split right here. So there's two trunks, and then on this one you can see it start to split again. Okay, pulmonary arteries. Pulmonary arteries are going to take the blood out to the lungs and get oxygenated. Okay. Then what is going to bring the blood back to the heart? The pulmonary veins. Now the blood is oxygenated. Okay. So you have pulmonary veins bringing the blood back. The blood comes back to the other side of the heart. The blood comes back from the left and the right pulmonary veins into the left atrium. And here you have the same process. The blood goes through the left atrium into the left ventricle, fills up the left ventricle. When the left ventricle is full, the blood continues into the left atrium, continues to back up into the left atrium. The left atrium then contracts, squishes that blood into the left ventricle, which stretches a little bit. Then the left ventricle begins to contract, and as the pressure increases, the door between the atria and the ventricles closes. Now, based on what we call this door, what would you call that door?
Bicuspid.
The left, okay,
Bicuspid, because there's two.
all right, the left atrioventricular valve, or the left AV valve. Everybody got that part?
Mm-hmm.
Okay, now, we said that if you describe this based on how the cusps are shaped, or how the leaves are shaped, this one would be called the tricuspid valve here on the right. Over here, the leaves are arranged differently. There are only 2 leaves. So what would you call it? Bicuspid. Now, the Pope, I'm not Catholic, but the Pope wears a hat. Yeah. You've seen the Pope wear a hat? Yes, this hat thing was pointing. Okay, it's just called a mitre. Okay. Okay. When you look at the way the cusps on this side are arranged, to somebody that looked like the Pope's hat or a mitre. So this is also called the mitral valve. Okay, so that one's got 4 names. Okay.
So the left AV valve.
The left AV valve, the left atrioventricular valve, the bicuspid valve, or the mitral valve. It's usually called the mitral valve. The mitral valve. Okay, now let me ask you a question. If the mitral valve leaks, where's the blood going to go? Back into the left atrium. That's called mitral regurgitation. One of the ways that it can leak is if the door doesn't close properly, or if the door bends so that it goes too far back into the atrium. That's called mitral valve prolapse. There's an article up on ThinkWave about mitral valve prolapse. There are many women out there who are confused about whether they have mitral prolapse or not, and if they do, whether it's a big deal or not. Okay. All right, so our blood has come through the left atrium, filled up the left ventricle, backed up into the left atrium. The left atrium has contracted, squeezed down here to the left ventricle, which has stretched a little bit. The left ventricle now begins to contract, increases the pressure. As the pressure increases, the door snaps closed. Okay.
Mm-hmm.
We said that when the AV valves snap closed, that's called lub or S1. When the pressure increases far enough, it blows the back door open. Now on here you can't see the back door real well. I think your book has a picture, it's a little easier to see it. The back door again is a semilunar valve. In this case, the aortic semilunar valve, or the left semilunar valve, or the left SL valve. Okay. Now, when the blood all gets out of the ventricle is going to start to relax. If you've got blood up here in the aorta, and the ventricle starts to relax, and there's no pressure on it anymore, where's the blood going to want to go? Back into the ventricle. What keeps the blood from running back down into the ventricle?
The aortic.
The SL valves close, okay, and they're kind of cup shaped, so they can close. Okay. That keeps blood from running back in. Same thing on this side. When the right ventricle finishes its contraction and begins to relax, the blood's going to want to run back out of the pulmonary artery back into the ventricle, and so the pulmonic valve closes. So at the beginning of ventricular contraction, your AV valves close on both sides, right? And you can hear that. At the end of ventricular contraction, your SL valves close, and you can also hear that. That's called dub, okay, or S2. Between S1 and S2, your ventricles are contracted.
Could you repeat that? So S2 is from the aortic valve closing, or
and the pulmonic.
and the pulmonic?
For both sets of SL valves closing. That's S2.
Okay.
Okay. Now, there are some people, in particular pregnant people, where the aortic valve and the pulmonic valve won't close at exactly the same time. If you get that, it's called a split S2, and it's usually not a problem.
Is that from the increased blood supply?
And also there's some differences in intrathoracic pressure when you breathe in and breathe out. Don't worry about it. All right, everybody with me so far?
Yeah.
Okay, let's take a break and then we'll come back and pick up here.
So the pulmonic valve. Okay, I'm good.